Thank you. Thank you very much, Ishmael. As I normally do, not out of disrespect of the health protocols, for the sake of those with hearing challenges at home, at least they can see my lips to follow what we are saying better. Program Director Ishmael Mnisi, thank you very much. Let me start by greeting our Deputy Minister, Buti Manamela, the two Directors General as introduced of our two departments, the Deputy Director Generals from both the departments who are here, members of the media, ladies and gentlemen. Our public statement today on the reopening of the post-school education and training institutions, the developments and contributions of science and innovation in the fight against COVID-19 follows numerous addresses by our President Cyril Ramaphosa on the impact of COVID-19 on our communities and their livelihoods. This COVID-19 crisis is connected to a wider set of crises, that of crisis of social inequality, of climate change, of technological disruption, and linked to all of the above, what one would call a crisis of the global capitalist system itself. This epidemic has dominated our minds and hearts in the year 2020 and seems will do the same this year. It has brought unprecedented challenges for the leadership and management of both our post-school education and training sector and our national system of innovation. I was just telling our Deputy Minister now, who was saying it looks like last year, this year is going to be the same as last year. And I was saying, well, remember, Deputy Minister, a calendar year only measures time, not events. So COVID-19 is continuing despite the fact that we're in a new year, which must send a message to all of us that, yes, we wish each other a happy new year, but we have a duty to make it a better year. We had to change the manner in which we allocated our human and financial resources midstream. We had to mobilize all our stakeholders in both these sectors so that as government and all our stakeholders could in unison agree on a common program for implementation. Indeed, it has not been easy. It has not been an easy road to travel, but it has been made to a certain extent rewarding to government because of the cooperation that we have received from a variety of stakeholders. And without that cooperation, we would not be even where we are now, where we are able to say we are to a certain extent managing to save the academic year, deploying our resources of science to deal with the pandemic. We have continued with ongoing consultations with all our stakeholders through the COVID-19 Ministerial Task Team, which is chaired by our Deputy Minister, which comprises of representatives from Universities South Africa representing our University Vice Chancellors, the South African Public College Organization, SABC. You see now, their old acronym of SACPO, S-A-C-P-O, they've changed it because they thought it's too similar to another organization, S-A-C-P-O. Now they are saying SAPCO, so that they don't get confused with other organizations. Or nepotism. Trade unions who are part of this team, as well as student representatives, mainly from the South African Union of Students. On our science and innovation interventions, we are pleased to say we continue to work with our sister Department of Health, the South African Medical Research Council, the Academy of Science of South Africa, KwaZulu-Natal Research Innovation and Sequencing Platform, known as CRISP, our entities of the Department of Science and Innovation, the Council for Scientific and Industrial Research, the Human Sciences Research Council, and the National Institute of Social Sciences and Humanities, the Center for the AIDS Program of Research in South Africa, CAPRISA, and the BioVac Institute, the pharmaceutical company that is half owned by us as government. I will commence my media briefing by reporting on some of the most significant science and innovation interventions to date. As the Department of Science and Innovation, we have to date invested 68 million rands, just over 68 million rands, reprioritized from the 2019-2020 and 2020-2021 budget allocation towards COVID-19 research and development activities. These funds were approved to support COVID-19 research and development in the areas of diagnostics, therapeutics, vaccines, surveillance and epidemiology, including what is known as genomic epidemiology. All these are scientific disciplines and research areas that are very important in understanding and tracking COVID-19 so that we can ultimately defeat this virus. On vaccines, the demand for an effective national COVID-19 vaccine plan and the threat of future pandemics has thrust the country's ability to develop and manufacture vaccines locally into the spotlight. I do want to say this, that we want to use this opportunity of acquisition of vaccines to also put in place measures so that we can actually build our own local capacity for at least the production of vaccines. And this is very important because our scientists are telling us that, in fact, we have entered the age of pandemics. That it's very possible that even before the next 10 years is up, we may be faced with another virus. And if we are not building our own capacity, we will be in trouble. And as the Department of Science and Innovation, we are determined to use this crisis as an opportunity to strengthen our local capacity for production. Government, through the Department of Science and Innovation, as I have said, we own about 47.5% stake in the company called BioVac, which is a biopharmaceutical company, which is a joint venture with the private sector. The company has over the years developed the capability to manufacture vaccines. At least we have a foundation. We must also say, by the way, that South Africa has also been a producer of many other vaccines that are important for our country and for the African continent. Last year, I launched an initiative which sees BioVac manufacturing Hexasim in partnership with Sanofi, a company. Hexasim is the world's first fully liquid 6-in-1 vaccine, and that protects against diseases like diphtheria, tetanus, whooping cough, khwehlela okungapheli ngesizulu, hepatitis B, Haemophilus influenza type B, and also the vaccines against polio. So we do have a foundation that we need to build on. Hexasim is the first World Health Organization expanded program on immunization vaccine to be manufactured in South Africa and is a strong indication of the technical abilities of South African scientists. There are 2 studies currently being supported in the area of vaccines. The first is a study on plant-based manufacturing of antibodies for COVID-19, which aims to facilitate the rapid development of the coronavirus set of vaccines, therapeutic antibodies, and diagnostic reagents, utilizing various expression platforms for advancing and production of the COVID-2 vaccine candidates and what are called reagents. Our Council for Scientific and Industrial Research, which is one of the entities of the Department of Science and Innovation, has entered into an agreement with Kentucky Biological Products, not the other Kentucky, for the potential manufacturing of the antigen of their vaccine. The Kentucky Biological Products vaccine is manufactured using specific tobacco plants. The CSIR, our Council for Scientific and Industrial Research, has the ability to expand their current facility for plant-based expression systems to manufacture the antigen needed for the vaccine. This company from Kentucky has also expressed interest in testing their vaccine in South Africa. The total investment in this initiative is about 2.4 million rands. There is also a second vaccine trial that we are participating in. In partnership with the South African Medical Research Council, the department is co-funding a study led by Wits University aimed at assessing the safety, immunogenicity, and efficacy of a COVID-19 vaccine candidate in South African adults who are living without HIV, as well as safety and immunogenicity in a small cohort of adults living with HIV. We're doing this because it's very important for that when we deal with COVID-19, we also look at it in relation to other diseases that are also a challenge to us. In other words, in relation to the disease burden that we have as a country. Our scientists are doing a lot of work in some of these areas. This is part of an international study aimed at finding a vaccine that will prevent infection by the virus that causes COVID-19, but also assessing whether the vaccines will be effective in local settings. This vaccine was developed at the Oxford University Jenner Institute in collaboration with AstraZeneca, and it is currently being trialed in a number of countries, including South Africa, Brazil, USA, UK, Australia, and Europe. Preliminary results indicate that this vaccine could reduce virus transmission based on an observed reduction in asymptomatic infections. The results indicate that the vaccine is at least 62% effective when given in 2 full-strength doses, compared to the 94% efficacy achieved by Pfizer and Moderna candidate vaccines. We are participating in this, and it's progress that is being made. Of the few vaccines approved globally, the Oxford vaccine, while not as effective as the Pfizer and Moderna vaccines, as I have said, has been touted as the most suitable for developing countries due to its cost and because it is comparatively easy to transport, store, and distribute. This vaccine is currently being considered for approval by the European Medicines Agency. Approval has been granted by the regulatory authorities in the UK, India, Mexico, Bangladesh, and Argentina. This initiative is funded to the amount of 4.5 million rands. The long and short of what we are saying is that as the Department of Science and Innovation, working with our scientists, we are fully part of the effort of not just the acquisition of the of the necessary vaccines, but also participating in further scientific studies about vaccines in our own country. I'll come back to what also this means in the light of some of the false stories that are being told about COVID-19 and the vaccines. On the matter of what are referred to as COVID-19 variants, genomic research has proved to be a potent tool in the fight against COVID-19. Investigations by South African genomic scientists into the evolutionary characteristics of SARS-CoV-2 resulted in the detection of the new variant, which scientists call 501Y.V2. The research conducted by local scientists from the KwaZulu-Natal research informatics and sequencing program should be uploaded. Nanye into esifuna ukuyisho. Njengoba leli gciwane manje selingathi lunohlotshana oluthile lo lesibhekene nalo manje ongathi libulala ngamandla kakhulu. Umsebenzi walomnyango wami esiuqale ngoJune ngonyaka odlule ukuthi ake selibhekelele igciwane ukuthi njengoba liqhubeka nje lisihlupha ngabe kukhona yena ukuhamba la lishintsha khona ukuthi libe ngcono noma libe nobubi obungaphezulu kwalokho. Lokho kutholakeleka ukuthi ngempela kukhona olunye uhlotshana manje oluvelayo lwaleli gciwane oluyingozi kakhulu. Umsebenzi nemali efakwe yileminyango yami kulo msebenzi sisebenza nosolwazi nososcience. And we are pleased to say ukuthi this research done by CRISP, they were the first in the world to uncover the findings, showing that this variant has a number of mutations on its spike protein, which increases the efficacy of the virus to infect humans and potentially posing problems of vaccine escape. This work is continuing through our Department of Science and Innovation, and we've allocated this research institute called CRISP at the University of KwaZulu-Natal a further 25 million rands over the next 12 months to complete the sequencing of 10,000 SARS-CoV-2 genomes in South Africa and the rest of the African continent. Sibanika le mali labo so science ngoba sithi abaqhubeke ngoba sifuna kugcineni ukuthi sikwazi ukuthi silwe ngokuphumelela naleli gciwane ngokulazi ukuthi uma libuye lishintsha liba yini ngoba lifana nomthakathi indlela elisebenza ngayo. The funding will be used to understand the spread of COVID-19 and other virus lineages in Africa and to support clinical and laboratory investigations of genomic variations in the country. In this regard, our key task now is to get a better understanding of the mechanisms of the increased transmissibility and if there is any evidence of increased pathogenicity, which refers to a different disease profile or whether reinfection can occur. Our scientists continue to work with their international counterparts to ensure that knowledge is pooled in order to bring COVID-19 under control. Also science bakithi basebenza no science bawonke amanye amazwe omhlaba, amazwe amaningi omhlaba ukuze sikwazi ukuthi sithelelane ngolwazi ukuze sikwazi ukuthi sibhekane nalomthakathi owukhuvethe lo esibhekene nawo. The Department of Science and Innovation has also funded local clinical trials. Scientists from DSI funded CRISP, the one at the University of KwaZulu-Natal, and have been meeting with the world's top scientists, as I have said, every 2 weeks to discuss the evolution of SARS-CoV-2 lineages. The center has been sequencing these genomes locally and sharing its findings. Beyond these measures, the Department of Science and Innovation is also working closely with agencies such as BioVac to investigate a long-term strategy for a robust and integrated national science and innovation platform to reduce South Africa's vulnerability against pandemic outbreaks. We will also be working with other government departments, our sister departments, as well as the private sector and other sectors in this regard. On the national science and innovation sector, I wish to also announce that we will be convening a panel of scientists to provide a platform for scientists in the next couple of weeks to share with society on what science is saying about the role of vaccination in our fight against COVID-19. They will also openly discuss the implication of the new variant on the current vaccines and myths about the vaccination, both biomedical and social science issues. We will convene this panel of the scientists because we want society to listen carefully and ask questions that how do we arrive at vaccines? This thing that all of a sudden there are people who are questioning vaccines now has got the danger of misleading our people. All of us, when we are born, we are vaccinated, by the way. All of us. Even children who are being born now as we are speaking, They are being vaccinated against polio, against many other diseases that have actually been there. So it's not that this thing of a vaccine is new. And vaccines go through rigorous scientific testing. This thing that the 5G is bringing COVID-19, it's not true. It simply is not true. And many other stories that are being told about COVID-19 that are not there. We urge our people to listen to scientists. We know that sometimes when we are under pressure and we are faced with this killing virus, all sorts of stories start emerging, which are essentially not true. We want, though, to do this in the couple of weeks by convening a group of scientists who are going to explain how vaccines happen and what is being done so that we are open and honest as government and as a country about what is being done. Besicela abantu bakithi ukuthi kabeke ukukhohlwa zonke le nganekwane ezikhulunywa ngokuvethe. Ukuthi ukuvethe lenziwa imbhoshongo lemkhulu yama cellphone lo esithi 5G yokufika. Sekuze kube nendawo kuthiwa iyalinyazwa lembhoshongo ngoba iyona lethu ukuvethe. Ayikho leyo nto. Sizoqoqosa science ukuthi bazochaza kahle emasontweni lazayo ukuthi ukugoma lokhu kusukelaphi. Lento isiyenziwe ngazazathi ukugoma kugonywa zonke izinsuku sonke akekho nje ngikhuluma naye ungazange agonywe semncane. Ingane umazalo ziyagonywa zigonyelwa izifo eziningi nje esizaziyo. Into ekhona ekade yabakhona indaba yokugoma nanokuthi imigomo le esetshenziswayo kusuka kuphenywe kwabanzi ngayo. Ayiqali nanokuthi isetshenziswe kubantu. Sike siqale isetshenziswe ezilwaneni kubonakala ukuthi yenze njani. Kuyimakudlulelwa izotest ukuthi iyasebenza yini kubantu. Besicela abantu bakithi ukuthi ke silalele nalabahola abanye abasukuma bakhulume izinto ezingelona iqiniso. Ngokugoma sicela ukuthi ke bahlale uma beyixoxa bayixoxele bebodwe emakhone nabo bangeze ukuzokhuluma nabantu bakithi babalahlise ibe inhloso kahulumeni ukusindisa imphefumulo. I will also be convening an imbizo through the Human Sciences Research Council and the National Institute of Social Sciences and Humanities to analyze and come up with concrete suggestions to government and society as a whole on how to deal with the psychosocial impact of COVID-19 on families, communities, and society as a whole. Sizobiza ochwepheshe bakithi ukuthi abanye futhi ukuthi ke bezobukisisa kahle ukuthi yini imphumela yalokufa esibhekene naso nalesi sifo ezimpilweni nje zabantu bakithi nasengqondweni zabo. Siyazi ukuthi sinenkinga enkulu namhlanje ukuthi sishonelwa zihlobo. Asikwazi nokuyoyibona bisagula esibhedlela. Asikwazi ngisho nokwenza izintwanyana esiye sizenze uma ngabe sishonelwe ngenxa yalesi sifo. Ingakho sithi ke futhi ke mina njengongqongqoshe nje ngiyakwamukela ukuthi ingonyama yesizwe sakaZulu icela ukuthi abantu bakithi ke bayiyeke eminye imikhuba abayenzayo uma ngabe kuthiwa izoba ingozi empilweni zabo. Sengathi bonke abaholi abakulezo ndawo kulezo khundla ke badlulise lo myalezo ofana nalodluliswe ingonyama ukuthi asenze zonke izinto ukuthi sibambelele. Siyazi ke nokho ukuthi uma singakwazi ukwenza ezinye izinto ezayamasiko ethu kuye kusidalela ukuthi sibe nengcindezi. Ingakho sithi ke labo ochwepheshe nezifundiswa zakithi okuyizona eziye ziphenye ngempilo yabantu nokuthi abantu baye baziphathe kanjani uma bebhekene nengozi enjenganale. Ngizoke ngibahlanganisa ukuthi ake sibonisane ukuthi lezi ingozi esingase sibhekane nazo nengcindezi ebheka imndeni nemphakathi bangasinika masumane namaqhingamani ukuze sizame ngako konke okusemandleni ukuthi impilo zabantu bakithi zibe ngcono ngoba yebo kuba uma sishonelwe kodwa kufanele sibheke kuphela nje ukuthi kushoniwe. Laba abashonelwe inhliziyo zibhlungu. Senza kanjani ukuthi singayivumeli lento yokuthi sigcine sakhe isizukulwane sakusasa esizobe sidlule kulobunzima kodwa kuthiwe akwenziwa ngalutho ngalo. Uyongixolela ke Ishmael ngoba kungathi ngiyankanta nje ngoba ibalekile lemiyalezo ukuthi sidlulise. Nanokuthi yenye indlela yokucela kubantu bakithi ukuthi sibambisane ukubhekana nalomthakathi esibhekene naye. Akangeneke manje. Let me come to the post-school education and training developments and interventions that we are making. On deaths due to COVID-19 in our post-school sector, which is universities, TVET colleges, and community education and training colleges. As of 13th of November last year, which of course, it's information that's a bit old, but we are busy collecting new information which we will be getting very soon. In universities, there were positive cases that were reported of about 3,888 with 1,499 staff and 1,588 students. The total number of deaths at that time, by 13 November last year, was 58, 48 staff and 10 students. As I'm saying, we will be receiving updated reports on infections and fatalities on the 20th of January, this month. We are collecting this information at the moment. And we want to make it clear that if we identify that there is a rapid increase in particular institutions or campuses of infections, we'll close those institutions. No doubt about that. And if we identify cluster infection of a serious nature, we will close down immediately. But I will explain what is happening now in our institutions. We have already, of course, had sad news that 48 staff members and 10 students had passed on last year, as I have said, and we know that infections will have risen over the festive season as well. We want to also express our condolences to all those in our sector who have lost their relatives, and wishing those in our sector as well as their relatives who are affected or who have actually caught this virus that they recover speedily. TVET colleges also, we are collecting information. And what we have at the moment is that cumulative reporting between 15 December 2020 to 11 January, there were 146 staff infections with 123 recoveries, some good news. But also we lost 23 staff members in the TVET college sector. The community education colleges, the infections between December and 11 of January, as I have said, were 98, and recoveries were 85, and 4 passed away. Given that the system has been closed for the festive season, it was not possible to collect further data, as I have said, but we'll continue to collect further data. On higher health. Now, higher health, which I have explained many times before, is our entity of the post-school education and training sector, which helps us to focus on health, wellness, and wellness for both students and staff members, and has been supported by the Department of Higher Education and Training. They've been helping us to manage our response to COVID-19 across the sector. Working with other experts, scientists, and stakeholders, especially the World Health Organization, the National Institute of Communicable Diseases, our sister Department of Health, and other agencies, Higher Health together built comprehensive programs, systems and controls, and infrastructure for our sectoral response to COVID-19. This included the establishment of guidelines, protocols, and capacity building, which is all grounded in science. Okay, Paman's way, Ishmael. Ngoba now sit to the one. Now, these protocols have played a very important role towards the successful closure of the 2020 academic year in a number of institutions, as thousands of our students have already written exams and many more will be writing in the coming weeks and months. To this end, we've updated all COVID-19 protocols, guidelines, and training materials with the evolving scientific advancement to enable retraining and strengthening management and frontline teams for the reopening of institutions during this lockdown level 3, alert level 3. We are gratified to report that as much as the focus and emphasis by higher health in our institutions has been on COVID-19, but higher health continues the good work of providing services on other student health and wellness challenges and epidemics, including focusing on mental health. Now, this is very important, as I had outlined earlier, that when looking at the impact of COVID-19, we must not only look at the physical harm it is causing to people, but the mental stresses that it also brings about to the victims, together with their families and relatives. At least higher health is focusing on this in our sector, and also focusing on other student health and wellness challenges and epidemics. Over and above mental health, also higher health is focusing on gender-based violence, HIV and AIDS, amongst others. In other words, the message that higher health is sending, which also should be a broader societal message, is that whilst focusing on COVID-19, we must not lose focus on other health and welfare challenges in the sector. Because, by the way, COVID-19 often interacts with these other challenges. Like if you are HIV positive or these other diseases that are there, it does cause own complications. So it's very important that we share with South Africa that higher health at least is focusing on these issues in our institutions. I'm pleased to report that during the lockdown, over 100,000 students across our campuses, continued receiving HIV services and contraceptive support. All this is very important. Thousands of young women received access to reporting and subsequent gender-based violence support services, and the Higher Health 24-hour student helpline for mental health and GBV established in August 2020 has also to date managed more than 5,000 crisis calls. I have said to Higher Health, especially to both the DGs as well, this data that is in the hands of Higher Health must be analyzed. For instance, these 5,000 calls, who is calling? Indications are that it's mostly women students. Also, many of these calls are about distress as a result of gender-based violence. It's important that we analyze all this data collected by Higher Health, because that will give us a picture on what is going on in our institutions, generally, but much more specifically, during this period. This is very important data. I will be short and be brief here, Ishmael, because Higher Health is doing a lot of work. We have got other details that are in our statement. Because of time, I'll just highlight a few more issues. Higher Health has also capacitated and developed over 30,000 campus-based frontline institutional staff and student volunteers. Among them are residence officers on campus, off campus, and in private accommodation, management, student support services, campus security, and the cleaning staff. Also, Higher Health has developed what is called Health Check, which provides a screening tool for people to check themselves. And this tool assists with early detection, isolation. And thus far, over 7.7 million screenings have been done by over 1.6 million students and staff since early June 2020. We have also established mobile clinics. I launched one of them in the Zululand district in KZN, which is assisting in particular in the rural areas, assisting in the main colleges. I have also instructed Higher Health to create a post-school education and training strategy that is aligned with and supports the Department of Health's phased national vaccine strategy, and also to coordinate its subsequent rollout. We have also said, this is important, that the frontline healthcare workers of higher health must be included amongst the rest of the healthcare workers to be amongst the first to be vaccinated. Because these are health workers, but that are operating in our sector, that also they must be included with the rest of the healthcare workers to be the first in getting vaccination. We are working closely with the Department of Health on this score. I urge our institutions and higher health also to mobilize and capacitate our own healthcare workers, staff, and final year health science students to volunteer to be trained and act as extra hands supporting the Department of Health, as it would be impossible for 40 million people to be vaccinated only by the Department of Health acting on its own. In this regard, we will surely be playing our part with those that we have trained in the sector. We're also engaging with the Department of Health to say clinical students, like those who are training for nursing, for radiography, as medical practitioners, across the whole range of the health disciplines, they should also be regarded as health workers, because indeed they are training right there in clinics and hospitals. They are part of the health workers. They must also be included amongst those who must first be vaccinated when we have the vaccination here. Higher Health is working with a whole range of organizations in doing this work. We use this opportunity, therefore, that to say, as students head back to campus to write exams and prepare for the new academic year, it is vital to remind them that we have successfully conducted exams for millions of TVET and university students in the midst of the pandemic. And so we want to continue with the rate of students who have actually not written. But we are also urging everyone in our institutions to observe the health protocols. Social distancing, wearing a mask at all times, sanitizing as our educational institutions reopen. We must never get tired of doing this. We plead, we must never get tired of following these protocols, because this virus kills. Together we can protect our futures. On NSFAS applications, which is another important matter that we need to share in this press conference, NSFAS recorded over 750,000 applications for the 2021 academic year, which is a significant increase of approximately 25% growth from last year, an increase of about 185,000 additional applications compared to last year, and shows a high level of demand for funding support and access to higher education and training opportunities. Over 61% of the applicants are beneficiaries from the Department of Social Development, the SASSA grants, either for disability or the child grant and other grants. Now, of course, this is positive in the sense that this time we're using online applications, but we have managed to get so many applications, especially from those who are recipients of SASSA grants, because they represent often the most vulnerable who require help to be able to access NSFAS. Each university and TVET college has an enrollment plan and can only admit a specific number of students, and the competition for such spaces is very high. We are urging students to make sure that they make their choices as soon as possible. Students who have applied to a university should be aware that they are given a specific time to respond and accept a space. Some of the stakeholders, or from within the stakeholders, are saying we must reopen NSFAS applications. Unfortunately, we are not going to do that. Firstly, we gave 4 months last year. 4 months for those who want to apply. We are now focusing on screening for purposes of allocating those who are successful. We cannot, unfortunately, be able to reopen. But also, we need to say that, unfortunately, the reality is that not all students who apply for space at a university, for instance, will be offered one. So it's possible that as a NSFAS applicant, we are told you qualify for NSFAS, but if you have not gotten a space in a university or a TVET college, you will then not be able to get that assistance, because that assistance is meant for people who have been accepted. That has been the case all along. We are also going to be running the first phase of what in future will become the Central Application Service, which is working towards students having to apply only once through a central point, as it is happening with KZN institutions at the moment, rather than be applying to many places at the same time. Whilst we are in the process to fully develop the Central Application System, we are using what we call the CATCH system, which acts as a clearinghouse or referral system for students who have applied for a space in a university or a college but have not successfully secured a space. We've explained this before, but we shouldn't tire ourselves to explain it. CATCH helps by saying, if we have not been admitted, those students who have not been admitted in a particular university or in a particular program, their names will actually be moved to the CATCH system, which then will look for spaces in the rest of the system. Am I right, Dan? So that we try and make life easier, that students, as much as is possible, they are able at least to get a place to study, even if it might not have been their place of first choice. And that is very important. And the CATCH service will open when the National Senior Certificate results are released, which will be slightly later this year, sometime late February, according to the Department of Basic Education. In fact, the date that the Department of Basic Education has announced for the announcement of matric results is the 23rd of February. And the CATCH service will open on the 22nd of February. It's very important. More information about CATCH 2021 will be communicated closer to the time of the release of the matric results. And the Career Development Service, which can also assist in this regard, can be contacted at 086 999 0123. At 086, I repeat, 999 0123. On the project of provision of laptops to university and TVET college students. As indicated during our previous media briefing, the tender for the provision of laptops was fairly awarded on the 2nd of November 2020 to 5 bidders. NSFAS has given me a full report on this, and I am satisfied that this whole process went fairly transparently, openly, as per the prescripts of the supply chain management processes of government. Currently, NSFAS is engaging with the service providers that have been allocated to develop the implementation process, including specifications, ordering, order turnaround times, delivery, payment terms, warranty, support, and maintenance. At the same time, NSFAS is finalizing the implementation guidelines for universities and TVET colleges, which will be consulted with institutions before implementation. Siyacela-ke ningezi kumina noma kumanamela ukuthi ke manje ke njengoba laba abawu5 sebenikiwe nje bazo supplier ziphi ikhungo, akuwumsebenzi wethu lo, umsebenzi kaNSFAS. NSFAS is also engaging with individual institutions to assess laptop requirements. It is important to note that university students will use their learning materials allowance to buy the laptops, which they will own and will be used for the duration of their studies. Each institution will develop a policy through which this will be implemented in line with NSFAS guidelines. This is important, and for parents to know. These laptops will be owned by the students, which means if you lose it, that's it, unfortunately. Because we want to develop responsibility also for students to be able to look after what is theirs and what they need. NSFAS aims to complete these processes over the next few weeks, and once that is done, they will communicate specific dates to the institutions. On data, and the student data we are talking about is data for studying, is data only and exclusively to assist with study. We are working in collaboration with the Department of Communications and Digital Technologies. As a matter of fact, I was meeting with my colleague, the Minister, Stella Ndabeni-Abrahams, discussing, amongst other things, this very matter recently. And we will soon be resuming negotiations with the mobile network operators for a long-term solution to the provision of data for students within the post-school education and training system. We're tired of this thing that there's a crisis, we're going back. There's a crisis, we're going back. We want now to have a long-term thing, because the matter of data and online is going to be with us now into the future. So it's better that we reach a more long-term understanding with the mobile network operators on how we are able to do this. Our intention is still to make sure that no student gets left behind during these turbulent times of the pandemic. Unlike in 2020, when we were dealing with one academic year, at this point in time, this year, we are dealing with the 2 academic years in 1 year. We need to realize that. We are dealing at the moment with the completion of the 2020 academic year, and then we'll also be starting a new academic year now in 2021. On the completion then of the academic year, what I would like to say is that 2020, as you all know, was a year like no other. After a period of recess starting in March 2020, all universities moved to remote forms of teaching and learning. They had to adapt their systems and teaching methods to provide remote support during the early lockdown periods, in line with the regulations governing the lockdown levels. Our goal was to save lives and at the same time save the academic year. I should have said, by the way, that NSFAS students who have not yet completed their academic year will continue getting their allowances until they finish their academic year. Because government's commitment is to support deserving students who come from working class and poor backgrounds to get education. And remember, this is a bursary, which we are not supposed to pay back financially, but we do expect a payback. And the best payback you can give us is to work hard and pass. That is what your parents expect, and that is what we expect as government. This has been a challenging time for all institutions and for staff and students in our institutions. On universities, my department has been monitoring the system against a number of indicators, which we'll release to the media, as to what are the indicators that we are looking at to see whether institutions are ready in terms of completing the academic year, but also in terms of complying with COVID-19 health and safety regulations. Significant efforts have been made across all institutions to ensure that a fair opportunity has been provided to all students to complete the 2020 academic year. Our Department of Higher Education and Training has provided support to institutions through the reprioritization of funds into what we call a COVID responsiveness grant. This grant has supported universities to implement multimodal teaching and learning plans and campus safety plans. As a department, we are continuing to monitor institutions to keep track of academic and health and safety matters. I commend all the academic staff and management teams of universities who put in additional efforts to support the necessary changes to the academic year. Although the available funding at NSFAS is severely constrained, we need to say so, we will continue to provide, as I have said, allowances to those students who qualify for the extended academic year. The department also continues to work with institutions to ensure that additional costs for private accommodation can be kept to a minimum. And I would urge that private accommodation providers abide by the principles of this framework and that institutions continue to assist students in negotiating with providers where necessary. I recently received information from all institutions on their plans for the completion of the 2020 academic year in the light of the enhanced alert level 3 conditions. And while many institutions have completed the formal teaching programs for the academic year, some are still finishing academic programs as we speak and providing catch-up opportunities for students. In some institutions, assessments and practicals are still to be completed, and in others, supplementary exams are already underway. As previously reported, all institutions are following different academic plans to account for different program requirements and different conditions. 10 institutions, universities, have already completed all teaching and learning activities, including exams in 2020, one completed now in January, and are just finalizing special exams. The remaining 16 institutions are completing the academic year at different times, depending on their own academic timetables. We have also attached, for the purposes of the media, the dates by which the 16 universities are going to be finishing their 2020 academic year. It's between now and March. That information will be able to provide the names of institutions. I therefore urge all our institutions to continue to communicate their detailed programs with all their stakeholders, particularly with students, prospective students, parents, and workers, so that they remain informed at all material times on the rollout of the institutional program for proper decision making. We want to emphasize this with the Deputy Minister in particular, because we get phoned, University so and so, what is happening, Minister? What is happening, Deputy Minister? We don't run those institutions on a day-to-day basis. We urge management to make sure that they communicate timeously. Of course, where we can, because we may know some of the information, we will, but it's up to the institutions to make sure that they communicate. And we also urge all stakeholders to focus their effort in ensuring that their institutional plans are implemented as agreed and that they are communicated as agreed. And I'm confident that with the support of all the stakeholders, we should successfully complete the academic year by the end of February for the vast majority of institutions and by March for all the other institutions. And again, most of our universities now, especially those who have not finished, are either fully open or partially open. We have not this time imposed the last restrictions, the restrictions of level 3 last year, of saying only 66% of students. But each university we have said, come out with a plan of how we are going to maintain social distancing and all the health protocols. These are adults that we are dealing with, so that you are able to ensure that we finish the academic year as we save lives as well. And we are monitoring the situation, working with Higher Health very closely to ensure that we are able to deal with COVID-19. And as we have said, where there are huge infections, we will take action to close. We have told management that they should also do so. On the enrollment planning then, very briefly for next year, this is very important information. I'm pleased to say that all institutions have aligned the start of the 2021 academic year for first-time entries with the availability of the Department of Basic Education National Senior Certificate exam results. In other words, we are saying to parents who have had students or learners who were writing matric, don't panic. Our universities have planned in such a way they will open way after the matric results have been announced, so that all those who have been writing matric will have an opportunity to be admitted to our universities, those who will be admitted. So, no panic. The department will work closely with institutions in preparing the system for the opening of the 2021 academic year, which, as I have said, will take place between early March and mid-April this year. While the current focus is on the completion of the 2020 academic year, I will provide further information on plans for 2021 at a later stage, following engagement with institutions. But we've given direction for now that universities are going to be opening between March and April to give a chance to first-year students. Some students who are continuing may be called slightly earlier than that in some of the institutions according to their timetable. That's why we are saying institutions must please communicate, because the timetables are not the same. They've never been the same, by the way. I would like also to address very briefly recent media statements focusing on the UNISA Council decision to effectively manage its enrollment. In 2018, with the introduction of the new bursary funding for NSFAS, enrollment planning became extremely important. What does that mean? It means each university submits to us its enrollment plans, which includes the maximum number of students that they can take, and we hold them to that. Unfortunately, UNISA did not do that over the past 2 academic years, Tandy, if I'm not mistaken. And this has caused problems because you can't admit beyond your capacity. If you do that, you are actually creating problems. That is what we are trying to regularize. But I'll be issuing a more detailed statement on this matter. All what I want to say, those who are opportunistically trying to attack us, and me in particular, that I don't care about UNISA students, it's not true. We are engaging in these measures because we care about each and every student in our system, including UNISA students. And then some politicians that I won't name, whose political parties are saying goodbye because they are disappearing, they now find every opportunity to attack Nzimande and higher education instead of focusing on their tribally based political parties. I won't mention them. All what I want to say is that we are very serious as a department about having viable institutions. So some of this critical commentary is not necessary. Rather, let's work closely with all our institutions, including UNISA, to ensure that no students are unduly discriminated against, but at the same time, we are working within our enrollment plans. On TVET colleges, the approved 2021 academic calendar still applies and will be adhered to, which means students will return in a staggered manner on the 25th of January, the 1st of February, the 8th of February, and the 15th of February, 2021. What I have outlined, by the way, about what's going to happen at universities and what is going to happen at TVET colleges, we've just finally agreed with all the stakeholders in a meeting chaired by our Deputy Minister just on Saturday. It's been approved by the National Coronavirus Command Council and Cabinet, and also endorsed by our stakeholders, who also gave some useful suggestions on how we manage this situation. Remote learning support will be in place for students who will return in February in our TVET colleges. And the return of trimester students will be prioritized given the compressed study time for these students. And N5 and N6 students will return before the N4 students. This will allow for walk-ins to be better managed. Presently, colleges with the systems in place are continuing with online registrations. For the remainder, colleges have put systems in place to observe all COVID-19 protocols to avert the spread of infections. Now, it's going to be important, therefore, for college management, and we've been engaging with them, to be able to effectively and responsibly manage campuses located in hotspots. Community education and training colleges, which unfortunately is going to be the last matter to deal with in view of time. The rest of the matters we deal with on skills is in our statement. I'll just summarize that very briefly. On community education and training colleges, which in the past we used to call them adult education centers, they have completed their 2020 academic year, which culminated in the examination and assessment that ended at the end of November 2020. Currently, the process of marking of the student scripts by all 9 provinces is underway as we speak. As advised by the National Corona Council, Command Council and Cabinet, and after consultation with stakeholders, the Minister of Basic Education announced on the 15th of January that the reopening of schools has been postponed to the 15th of February 2021. Therefore, to ensure the safe return of staff and students to the centers, our community education and training centers, and also informed by the Department of Basic Education's revised academic program, the Community Education and Training College's 2021 academic calendar will change accordingly. It's because our community education learning centers mainly are using schools. So we get affected by what happens in the school system. So at the moment, the calendar for our community education and training colleges had initially indicated that lecturers will return on the 25th of January and returning students will return on the 27th of January. That was the original plan. Now, with this announcement by the Department of Education and Training, we are changing the Community Education and Training College calendar. The lecturing and support staff will report at their centers on the 1st of February 2021, and teaching and learning programs will start on the 15th of February 2021 for all the other programs. The management of teaching and learning, deployment of staff, as well as the management of the enrollment processes are the responsibilities of college management. We are also working with Higher Health, assisting the colleges to abide by the COVID-19 regulations. I'm happy to announce also that the National Treasury has approved 45.7 million rands to be transferred to community education and training colleges during the 2021-22 financial year as an earmarked allocation for cleaning services in these colleges. Those who had thought that cleaners and workers who do cleaning are nobodies, COVID-19 has reminded us that no worker is a nobody, and that those cleaning workers that we take for granted, COVID-19 has reminded us we need them even more now. Phambili nabasebenzi abasenzela indawo zethu zibe kahle phambili. On skills, all I want to say is that the skills development initiatives of the SETAs and the National Skills Fund were affected by COVID-19, but many of them now, the programs have started, including increase in intake of apprentices, learnerships, and internships. Artisan development, trade testing continues also with a limited scope in compliance with the adjusted alert levels, Regulations 3. And trade testing, it's very important that I say this, commenced on the 16th of July 2020. Testing candidates that were registered prior to the national lockdown, and new applications for artisan recognition of prior learning and trade test registrations commenced from the 28th of September 2020. In other words, those who must be tested for prior knowledge that they have had but had never been registered as artisans, they are also included in these plans that they can register in their trade test centers so that they get tested and they become qualified artisans. Abanye balabantu abazothola leli thuba ilabe sibe ababize endaweni zethu njengo bush mechanic abakhanda lezi imoto zethu isikhathi esiningi okuye kuthiwe aziphume lokushini zihlala ngaphakathi ngoba zikwazi ukuya edolobheni zizobanjwa. Sifuna nabo ukuthi bakwazi ukuthi lolo lwazi lwabo uma ngabe sibanika ithuba lubhekwe ngendlela eyona bathola icertificate babe omakhenika bangempela abaphambili abanencwadi. In conclusion, I know this has been a long briefing, but because we haven't had a briefing for a while and there are these new developments in our country in relation to COVID-19, we had to give these details. I know that this has been a challenging time for many students, a time for uncertainty and anxiety for all. We've been forced into this situation by a global pandemic, and students have had to grapple with self-study, often in difficult circumstances. I applaud the many students who have adapted to these difficult circumstances and developed new ways of learning and of coping. Abangasebenzisa lesimo ukuthi bavilaphe kodwa iningi labafundi bethu lisebenzise lesimo esinzima ukuthi basebenze ngokuzikhandla. Ingakho sinethemba ukuthi noma besinalesimo esibi akuyukuba nokho isimo sokuphasa kwabantwana bethu abaseyikhungweni zethu akuyukuba kubi. Already it's showing that some of the universities students have performed very well. The initial indications, we want to study why, because this combination of online, blended learning of online and contact actually may have done under difficult circumstances, beginning to show that maybe that's the way forward now, that we should be using blended learning and other modes of learning and teaching that our institutions have been using. I also wish to thank the leaders and managers in our post-school education and training sector as a whole. And also we wish to thank our frontline workers working with higher health. We also wish to thank the workers in general in our institutions who have actually been working very hard, often risking their own health and their own lives to make sure that our hashtag is realized, the hashtag of complete, or hashtag of save the academic year, hashtag save lives. Let me once more express also my sincere congratulations to all those who finished their academic year already and say well done. Let me also end by thanking my Deputy Minister, who has consistently been leading this COVID-19 effort through the task team, apart from the other work that he actually has. And also lastly, but not the least, I wish to thank the President. President has really been a source of inspiration and supported us fully in managing what we are doing, as well as the support from my cabinet colleagues, the National Coronavirus Command Council, and cabinet. Thank you very much.